Hi everyone. I hope all of you are doing good. Many of us have interacted before and you already know me, and some of you will be seeing me for the first time in this video. I am Dr. Sandeep Sharma, MD Pediatrics from PGI Chandigarh, and I am a practicing pediatrician as well as associated with the field of teaching, that is preparing students for competitive exams in NEET-PG, FMGE exam as well as NEET super speciality related to pediatrics. As you already know that NEET-PG 2022 is supposed to be held in the month of March as per the dates which have been released. So the purpose of me making this video is to discuss points from a student's perspective. As of now, today's 15th December, and if you look at approximate time you have left before the exam, if you go by official date, it is approximately 3 months. This 3 months is a critical time, and many of you will be grappling with issues related to how am I supposed to do revision and what is the ideal way. See, you need to understand that there is no ideal way. Through this small video of mine, I shall be discussing 2 or 3 model points, 2 or 3 model patterns, the so-called blueprints, which can help you in revising your exams better, revising for your exams better, and it will matter a lot when you actually sit in the exam. So let us begin with the discussion. Before we start with the discussion, there is a disclaimer I want to put out. The disclaimer is that it is strictly from my perspective. See, I can be wrong as well. We all have our own perspective. This is my perspective based upon the experience which I have seen, and whatever I'm discussing is from a student's point of view. Right. So this is not the only way you can prepare. There are 1,000 other ways to prepare. But for those of you who are thinking, sir, what is the ideal way? I keep getting so many messages, emails from students throughout asking, sir, how effectively you should be preparing. So this is my perspective on that. You can adapt and modify as per your specific needs because no two people are same. If you just listen to it, you will understand the things which I am trying to say. If you understand the principle and adapt to your existing preparation, I think you will benefit from it. And no single path or plan is perfect. Eventually, you have to stick to one plan. बहुत रास्ते होते हैं सेम डेस्टिनेशन तक पहुंचने के. If you stick to one path, you will eventually reach your destination. Most of us don't reach that stage because we keep on changing our path. We start with something that then we start feeling ऐसा अच्छा नहीं हो रहा, let us try this, let us try that. Please do not do that. Stick to one plan because every minute matters now with limited time to be left for your competitive exam. So what is the blueprint for revising? First of all, step one, before you start making any revision plan, there is a reality check you all need to do. Approximate time before NEET-PG 2022 is about 86 days, right? As I am recording this video. Next 3 months, they are going to be critical. They will decide the course of your life. Henceforth, once you get selected, after counseling and joining the college, you will be known no longer as a doctor. You will be a doctor, obviously, but you will be known as a pediatrician, orthopedician, radiologist, pathologist. That will be your identity for the rest of your life. So this 3 month is going to be very critical. Everything can't be done. You need to understand we are all humans. A lot of people say we should be reading 15 hours a day for the next 3 months. Sounds very good. Practically not possible. There are people who are able to do it, but they are 0.1%. Majority of us, it is not needed provided you are consistent, as we shall see, as we shall elaborate more upon it. And time is saved for everyone. Having said that, time is marginally less for those who are working, those who are in service somewhere, and for those who are into their internship. So you need to manage your time very effectively. It is marginally more for those who are not working and only exclusively preparing for the exam. But what you say in Hindi, 19-21 का फर्क है. There is not much of a difference. All you need to do is have a reality check where you stand and prepare accordingly. So being mentally prepared, how much time I have is the first thing to do. Step 2 is finishing the pending subject. Now what will happen is many of you will listen to a video, whatever plan I'm saying or some other faculty is saying, and then overnight you will, leave whatever you were doing and start doing with what sir said. Please do not do that. To emphasize, next 16 days before this year ends, right, you should aim to finish any pending subject which is there. We all have our pending subjects, areas we always tend to leave out. You should aim to finish any subject which has been completely untouched. Like some of you may not like anesthesia much. Some of you may not like retinal disorders much. So if you have totally untouched these areas as totally untouched, it is time you at least read them once from your notes or whatever source you are using. And subject not done in the past 3 to 4 months, also you should try to finish off in the next 16 days, because effectively your revision will start from it has started already, but it will effectively start, the blueprint I'm making will start from 1st January. And have a quick look at any trending or problem areas that you seem to have neglected. For example, you might be thinking, sir, COVID-19 is important, I will do it in the end. Do not leave it till the end. Anything new which comes at that time, you can do that. But right now, COVID-19, its variants, Omicron, and all these things you should be reading right now. Vaccines, new, old, atypical vaccines, malaria vaccines, all these trending things, you need to read them in the next 16 days before you actually start with intensive revision. And take stock of where you stand and how much time you can actually squeeze in. So whatever things you have been pending, not only in academics, but some mobile phone or laptop of yours, you wanted to give it for repair at service center, do it in the next 16 days. You had a friend who you were supposed to call and discuss something non-academic, do it in the next 16 days, because once the January time begins, you will not have time, you cannot afford to waste time on any of these things. So finish pending subjects and your personal commitments by next 16 days, right? So next comes your actual step, that is revision of all 19 subjects. Now, time available from 1st January to 11th March, I'm taking. 12th March will be the actual exam. So it will be about 70 days. So what you are going to do in those 70 days? You can't read cover to cover, you need to understand. All of you have notes. Many of you are members of a coaching institute as well. There will be itna mota booklets which you will be having of each subject. You can't read everything. You need to understand that. And you need to squeeze in at least 2 revisions. It's not going to be easy. One grand test every 10 days, irrespective of what plan you follow or whether you have a plan or not. One grand test, one full length mock test every 10 days is a must for every student. Many of you, most of you don't give grand test. I know it. When I was a student, I didn't used to give it. We all have our own defense mechanism. You know defense mechanism, right? Sir, abhi tayari nahi hai, tayari karunga fir dunga. Sir, if I give it without preparation, I will feel disheartened. Sir, last May I will give 10 mock exams. You are only fooling yourself. All these are bahanas. All these are only excuses. A grand test is not only meant to test your knowledge, it also helps you in fine-tuning your preparation, knowing, suppose you have done pediatrics and you give grand test, there are 10 questions of pediatrics, you are not able to solve even one of them. Every grand test will have some easy, some difficult questions. If you're not able to solve even one of them, whatever you have done is not sufficient. So it is a reality check before you sit for the exam. Second, it helps you in time management. Thirdly, once you give a grand test, you read explanation, important points you find, you mark them. Those points you will be able to revise later. You can't revise all the notes. Small little things. And every grand test, every 10 days when you give a grand test, your percentage, not the rank, percentage should be on a rising slope. Right? Small little things, but that is why grand test is very important. Now, there are 2 types of revision plans I have created based upon what suits you. You can also mix and match. Revision plan 1, I have called it as a old school plan. Old school plan means basically you are doing 2 revisions. First revision to be done in 48 days. Second revision is to be done in 22 days. So 2 revisions, as I said, one bigger revision detailed in 48, rapid revision in 22 days. Now how you are going to do it? First revision, you will divide, you have 19 subject, you will divide it into, this division is not based upon the subject. Every subject is massive. When you do MD or MS in each subject, you will know कि वो subject इतना बड़ा है कि it will not finish at all. But for the purpose of entrance exam, based upon NEET-PG and to a certain extent INI-CET exam, you can divide the subjects into weightage. So huge subject which give you maximum number of questions are 3: medicine, followed by surgery, followed by obs-gynae, right? Then for these huge subjects, you need to give 4 days each. I know it sounds very less, kaise hoga medicine 4 din mein, but understand, this is all we have. This is what everybody has. And you have to do it. You have to revise. How we are going to do it, I'll be coming to that point. So huge subjects, 4 days. When I say 4 days, many of you who are working interns, they will ask you, sir, 4 days kaise niklega? When I say a day, in this entire video, a day means 8 hours in the day, 8 hours of study. If you are able to do 12 hours, so basically 4 hours, half a day extra you have been able to squeeze it. That is a good thing. So 4 days means 4 multiplied by 8, approximately 32 hours you have for each subject revision. Very limited time. Then big to medium subjects. Big to medium subjects will include your 10 subjects. Pathology, microbiology, pharmacology, anatomy, pediatrics, ophthalmology, ENT, physio, biochem and PSM. Then you will have, for these big to medium subjects, you will give 3 days to each subject. You can give them together, you can give them one after the other. And then you have short subjects like skin, psychiatry, anesthesia, radio, ortho. Forensic medicine, frankly speaking, is not a short subject, but this is all based upon not the subject itself, but the weightage. In case you feel that your ortho or your forensic is very weak, you can add additional day, and from big to medium subject, you can probably take out half a day from one or two subjects, which you feel you have already sure of. For short subject, 1 day each. That is the only time you have. Sorry, students. Sorry, friends. This is the time you have. So 4 into 3 will be 12 days. 3 into 10 will be 30 days. 1 into 6 will be 6 days. Total 48 days. That is all you have to do in the first revision. So the question arises कि sir इतने limited time में what is to be done? In first revision, you should be focusing upon notes. Notes are a must. You can't do everything. You should be going topic wise. How to select topics, I will be coming to that. So notes are a must. Subject wise test for each subject is plus minus. If you have done before, you are at an advantage. If you have not done before, at least for huge and big to medium subject, you need to do some short subject wise test. For shorter subjects, you can take a calculated risk of not doing them because you don't have time. And past MCQs, especially last 3 years of NEET-PG, last 3 years of INI-CET exams, they have to be added. In case you are unable to do it now, in the second revision, you will obviously be adding them. So first revision, this is how you are going to do. Now, many of you will be saying, sir, I can't do OBS Gynae for 4 days, becomes too boring. Of course, when I was a student, I used to find OBG boring as well. I didn't know that being a pediatrician, I will be dealing with gynecologists on a regular basis. But as a subject, if you find a certain subject band and you feel that you can't read the entire subject 4 days, no offense to future gynecologists, it's just my perspective. When I used to be a student, gynecology per se for entrance exam is a very, very scoring subject, and it is actually a much exciting subject, much better subject in terms of your career wise. If you compare to certain other branches, I will not take the other branches names, otherwise people will get offended with me. My colleagues will get offended with me. So if you feel like that a particular subject you can't do entire day, you can mix and match. Like you can pick OBS Gynae along with probably anesthesia. So when you will be giving OBS Gynae and anesthesia, obviously you both the subject if you are doing, the number of days will get extended. So OBG plus anesthesia, you will total give 4 plus 1, that is 5 days in that period you have to complete. So it will be like that, right? You can change it according to whatever I have suggested. So this is only indicative. First revision, you have to finish in 48 days. Moving towards the second revision, which is you are going to complete in 22 days, that needs to be individualized. When I say individualized, you need to decide what are my weak subjects, what are my strong subjects, and you need to give time. You need to select topics, weightage according to your strength and weakness. I will not comment upon it because every student's strength and weakness will be different. If you want, we can discuss it in a second video, probably a month from now or 1.5 months from now. Time and subject you will give will be according to weightage as well as your own confidence in that subject, and you will focus in this second revision only on high yield topics. For example, if you are reading pediatrics, in first revision you have done neonatology well, right? In second revision, entire neonatology you will not do because you have already solved NEET-PG papers. You will know, you have solved INI-CET papers and pediatric questions. So you will know that even in neonatology, neonatal jaundice, neonatal sepsis, neonatal resuscitation, neonatal hypoglycemia, term and preterm newborns, asphyxia, and probably 1 or 2 more topics. These are the 7 or 8 areas which are important. So when you now revise neonatology, you will not read the definition of newborn, definition of perinatal period. You will read these 7 or 8 areas properly. It will save time and it will be more effective. You have already done them once, right? And in second revision, as I said, what you will be reading, topics from the notes. Not all notes, topics from the notes selected. You will do mark things in old GTs and subject wise test if you have given. You will do 3 INI-CET past papers, 3 NEET-PG papers have to be done, and you will consider rapid revision. When I say rapid revision, see, I am not promoting any A, B, C, D, M, B or T or D kind of, why am I using all these words? All these are, beginning alphabets for various coaching institutes. I'm not promoting any of them. All coaching institutes have their own rapid revision, whatever place you are offering, you have subscribed to. In case there is a rapid revision thing, you can consider, it is not mandatory, consider adding that. In case you are not following any coaching institute and preparing yourself, absolutely fine, stick to your notes. It is an optional thing you can consider adding. Again, not cover to cover, not all subject, only in weak areas, if you can afford, if you can squeeze in the time, right? So second revision has to be individualized. So this is the first plan. Sounds good, but personally I would find that unless you are sitting and preparing for a working or intern student, it will be relatively difficult to do. So second revision plan, which can work for any of you, is a retro smart plan. When I say retro smart plan, we'll be doing retro study and we'll be going selective. It will be risky, but again, it will be better than making a khichdi, making a mumbo jumbo out of whatever ways you are reading right now. So I call it as, that was 48 plus 22. Here it is 30 plus 20 plus 20. So as you would understand, there are 3 revisions we are doing here. First in 30 days, second in 20 days, last in 20 days. How we are going to do it? First revision, go retro. How will you go retro? You will solve, now you will not directly open notes. You will first solve MCQs of last 3 years of that subject. Then you will read those topics from the notes which have been asked in last 3 years of that subject. For example, you are going to solve pediatrics, my subject. So pediatrics, first of all of you have done MBBS, you know the basics of pediatrics. You're not blandly sitting, right? And it is a revision. It is not a theory-based thing. So you will first solve pediatric questions in INI-CET last paper, then previous INI-CET, the previous INI-CET. Then NEET-PG, the last NEET-PG which was held, the previous one and previous one. Make a list of the topics as you are reading that. So you will find there will be one list which will have all the topics which have been asked. All those topics you have to read from your notes. So when you open your pediatric notes, you have to read those topics from your notes. For example, you will find that there was a question asked on SSPE. So when you read that, solve that question of SSPE, you will read entire measles. You will not touch pertussis. It is important, but पूछा नहीं है. It is a small risk you have to take. How to cover that aspect? We will be coming to it. We will try to plug that gap of not reading all the things, but you are reading selectively from older by first solving MCQ and then going backwards. Time and subject will be proportionate to relative weightage in that subject, and what it means is medicine, surgery, OBG will require maximum time, followed by path, pharma, micro, followed by IENT, pediatrics, physiology, PSM, followed by shorter subjects. But how much time to give will be related to its weightage, and you have to finish first revision in 30 days. So what you will find is about 60 to 70% of the time which you had given for that revision, you can give here. That is all you can afford. So instead of 4 days in medicine, maybe you can give 3 days in medicine. Maybe instead of doing the entire day 8 to 10 hours of dermatology, maybe you can do it in 4 to 5 hours and try to squeeze in half of anesthesia or half of psychiatry also that day, right? So this mix and match you will have to do, and this is a risky plan, please understand, but it is better than not doing anything at all. What are the gaps? How will we be plugging them in the second revision? Revise second revision, you will revise whatever had been done in the first revision fast. Plus, what you will do here is whatever was topic related to that. Like for example, I had given the example SSPE asked in NEET-PG. So you have already done measles. Now when you revise it within next 1 month, it will be still fresh in your mind. You will go through it rapidly. Now, when you are reading measles, you will find pertussis and chickenpox also mentioned there. So you will have a look at pertussis and chickenpox rapidly as well if you have time. And trust me, If you go this way, you will have time. It will take time for you for the first couple of days to catch up, but as time progresses, you will be able to catch up faster. And one full day for huge subject, less for others. So in second revision, huge subjects will require medicine. One day में करना है. You will be saying, sir, कैसे होगा? Have to do, can be done. I have seen people do it. I have heard people do it and do exceptionally well in exam. Then you will add subject-wise test, marked points or questions from old GTs and subject-wise test, and you will consider rapid revision PDFs if you are following any. It is not mandatory, as I said. And in second revision, irrespective, this is a very, very important thing. Irrespective of whatever you are doing, you will be doing 2 high-yield topics per day in detail. कौन बताएगा? You know it already. 90% of things which any faculty or any motivator tells you, you already know it. But hota kya hai? We all are humans and we need validation. If somebody elder, somebody who has done that, what we are trying to do, somebody who is senior to us, he or she says it, it just validates things subconsciously in our mind and we are able to do it better. So what are the high yield top points? You already know them. COVID-19 will always be important. Dementias like Alzheimer's disease and Parkinson disease will always be important. Multiple sclerosis, myasthenia gravis, Guillain-Barré, CNS and stroke localization, stroke management, they will always be important. So pick 2 high-yield topics per day and do them in detail, like giving 20-25 minutes intensively. Like today, if I am reading about trisomies, I will spend half an hour reading down Patau and Edward syndrome, right? So pick high yield topics across and revise them. It will be better if you have a small diary, or you can keep writing the key points in that diary, because in third revision you will be revising them again. So third revision you will revise again whatever you have done in first and second revision. Multiple revisions will ensure your accuracy will increase. Why accuracy is important, I will discuss in the end. You will add the past papers again. Past paper second revision में नहीं था, so you were saving time there. First revision में किया था, and now you will add past papers in the third revision, and 2 high yield topics per day in details will continue here. So unbiased advice. So these are the 2 plans. You can mix and match these plans. You can modify it according to what you need, but stick to one plan. In case you don't have any plan, pick one of these and try to stick. I'm saying from my personal experience, I have made a lot of plans in my life. I have never been able to fulfill any plan 100%. But even in plans which have gone 80-90% according to what I had originally planned, I have done well in that. And that is true for almost everyone. So whatever plan you make, if you're able to stick to it about 90% or so, I'm not asking you to skip subject, but sticking to the plan, you will be doing excellent. Unbiased advice from my side. Every subject is important. Just because a subject is short, or just because a subject, you don't like, you cannot skip it. Because experience says the day you decide that this particular thing I'm going to leave, examiner that day will decide to put questions from that in your exam. This has happened to you in your MBBS. This will happen to you in your life as well. If you ride a bike and you always wear a helmet, nobody checks it. But the day you decide to skip it, you will either fall and hurt yourself, or there will be a traffic policeman who will challan you. So never take chances in critical areas, and that is your medical entrance exam as well. So do not skip subjects. Past MCQs, this is very important for many of you. Past MCQs of last 3 to 5 years are infinitely more important than you find those fancy, controversial, 20-line long integrated MCQs posted in Facebook, Telegram groups, hosted by a lot of people, hosted by coaching institutes. Past MCQs are always more important. Please understand that. Actual MCQs will always be better. Do not waste time in speculating the exams will get postponed or not. If they do, you get bonus time. You need to understand that. In case exams do get postponed, we don't know about the future. In case they do get postponed, you expand the plan. If you're following plan A, instead of giving 4 days to medicine, now you can give 6 days to medicine. But stick to the plan. Whatever plan, like if you have your own plan, stick to it. But don't start thinking and assuming कि because NEET PG counseling अभी delay हो रहा है, so other that date they will get. What happens? What will happen? Try to think if the exam does not get postponed and you have not prepared well. If you have, just been believing that it will get postponed, you will be in a soup. So it is always better to be safe than sorry and prepare according to official dates, right? And do not pay over attention to mock exams scores or ranks, because mock exam scores and ranks can be dicey, and a lot of students score very high numbers in mock exams but they don't do well in actual exams and vice versa. Of course, some toppers of mock exams do top in actual exam as well. So there are people on all sides. Do not pay undue attention. Use it to monitor your preparation, not to feel bad or not to feel demotivated. So there is one suggestion I've especially added at the last moment related to some of the messages I got on Telegram and on Instagram. How to tackle problem areas, sir. Like, so this thing which I'm discussing here is optional and not mandatory. You identify one or two problem subjects. Everybody has problem subjects. So suppose uh, you have pharmacology, right? So first you will exclude them from the revision plan you have made. So you will have 18 subjects to revise. So what to do with this problem area? Irrespective of revision plan, you will devote 1 hour daily to that subject at a fixed time. What it means? For example, pharma is your problem area. 5 to 6 p.m. for the next 3 months, starting from tomorrow, that will be your pharma time. Pick your time, right? But it should be a dedicated time at which you will be reading pharmacology daily. If you are weak in obs gynae, 10 to 11 p.m. Fix it. You will read obs gynae daily for the remaining 86 days. You will split it like 86. So about 50 days, I will finish the entire subject once. You are giving 50 hours, remember, and then you will be revising it. Because you have excluded one subject from your revision area, you will have time for other subjects as well. Plus, you are doing the problem area intensively on a daily basis at a fixed time. Your brain will be conditioned, and because you are reading on a daily basis, your concepts will be better, and that subject will turn into your strength. I have done it myself. I've done it. I'm saying this from personal experience. Try it if you find some area as a problem area. That does not mean कि pharma में you open Goodman and Gilman and start reading that. No, things approach will remain the same. But the time to read standard books is gone. You can't read Harrison right now. But Harrison tables, if there is a source, you can read that and add it in your medicine-based subject. You can always do that. So this is one suggestion which I can make from my side. And you try to fit two proper revisions from notes in retro way for that particular subject. So what past NEET-PG and INI-CET exams which have been recently held, they have told that most MCQs are asked from expected topics and not from rare topics. Direct repeats are very less, but topic repeats form a very significant chunk of MCQs. You need to understand this. Accuracy is more important than subject coverage. Have you seen the amount of clustering which has happened? One or two silly mistakes can throw you out of the race in an easy exam. Accuracy is more important rather than reading rare things. Rare things are needed, but not beyond a certain point. Accuracy in expected things will reap more dividends for you in the paper. Integration of multiple subjects is a reality, adapt to it. Focus of some subjects have shifted. For example, systemic path, more questions are asked if you compare to last 5 years. Ortho clinical cases are more commonly asked. Vaccine scenarios, infectious diseases, they have slight more weightage than before. So you need to focus your attention based upon the recent exams. And 90 to 95% paper is always doable or markable. I'm not saying attempt kar do, but it is always doable. It is just that we forget or we don't practice MCQ, so we are unable to do it. But 10% paper is, not solvable. Remaining paper is always solvable in any exam that you pick up. So in the end of this video, 4 things you must not forget. First, it is not Kabuki syndrome which will hurt you in the exam. Because if Kabuki syndrome is asked, except for people with a very high IQ or people who are fond of reading very rare things, it is the same old Down syndrome which you did not read well or lacked accuracy that will bring you down. If I ask, there are 3 categories of people. One category of people, they won't read Down syndrome at all. So they have, relatively less chance of getting selected. Because if they have not read Down syndrome, means they have not read similar important short topics in all the subjects. And so their level of preparation is not up to the mark. It's a competitive exam, right? So I'm not being biased, but it's a competitive exam. You need to understand that. Second category will be a big number of students who will read Down syndrome, but they will only read Sandel gap, trisomy, triple test ke 3 marker, and then they will move forward. If triple test the 3 markers are asked, which one is not part of triple test, you will be able to do it. But in case they ask positive predictive value or they ask about cell-free fetal DNA accuracy rate, somebody who has read it in details and knows that antenatal diagnosis of Down syndrome is very important, and cell-free fetal DNA detection has 98% accuracy, and you remember it in the exam, this set of students will have a chance of getting top ranks, because if they have done this level of accuracy, this level of revision in important areas in Down syndrome, their similar level of accuracy will be there in other important areas as well. So prepare according to the exam pattern, read important topics and focus on accuracy. That does not mean disclaimer, डाउन सिंड्रोम से क्वेश्चन नहीं आया, so don't say sir आपने बोला मैंने तो डाउन सिंड्रोम पे थीसिस कर लिया. What I'm trying to say is whatever is mentioned in your notes, your accuracy hold should be fine. Second thing, cut the noise. There is a lot of noise around. These days you have a problem of plenty, not a problem of paucity. You have multiple coaching institutes, lots of free classes, lots of every PDF you can imagine that is available in the market of textbooks and all. Cut out the noise. End of the day, decide this is what I'm going to read. I'm going to cut out all the noise about postponement. Know about it only from official sources, reliable sources. Cut out the noise about when will next exam come, kya pattern hoga. Say to yourself, I am not going to wait till next exam. NEET-PG, whatever exam happens, I am going to finish off this race as of now. People talking about that thing is better, that book is better, that faculty is better. No teacher or institute or thing is good or bad. It is how we make use of it that is important. Cut out the noise. Focus on your own preparation. Point number 3, believe in yourself and do not panic. If you start panicking, say to yourself, I've read everything. Question होगा, 4 option होंगे, वो 4 option में से answer I have to identify. That is all you have to do. And point number 4, hard work never goes waste. Even if your exam goes a bit shaky, it's a competitive exam. Still, life continues. You get another chance. There was a movie where there was a dialogue. Chance कभी last नहीं होता, हमेशा second last होता है. You always, life gives you, if you have worked hard, life gives you a chance to recover, and you do recover, and the hard work which you have done today, it will always come handy to you. So don't fret, enjoy this preparation time. Do not feel burdened by it. There are episodes of pressure, there are peer pressure, family pressure, our own mental pressure, but try to enjoy it. It's a phase in life which will decide your identity. And if you do well, if you stick around and just stick to the basics, you will do extremely well. And irrespective of result, believe in yourself. One exam cannot define you. Learn from your mistakes, move forward, keeping in mind that whatever hard work I did in the previous exam, it will come handy in this exam if it did not help me in the previous exam. Because all information is coming right here. That's all from my side. That's my perspective. If you disagree with anything, you're most welcome to share views. And if you want me to discuss or elaborate on something specific or come a bit later and talk about something specific, I'll be more than willing to do it. So this is Sandeep Sharma signing off. Thank you very much. God bless everyone.